Good afternoon, everybody. Today's August 27th, 2021. My name's Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. Again, our website with some of the information on these slides, case counts, where to get vaccinated, testing, things of that nature. falmouthma.gov, so falmouthma.gov. Direct emails to the health department go health@falmouthma.gov, and our phone number is 508-495-7485. So for the week, we are at 1,689 cases, which is 20 for the 7-day period leading up to yesterday. I cut the data off on Thursday nights just to be consistent. There's, in addition to that, there was 6 probable cases. Roughly 98% of the population are not in isolation that have had cases. Our daily incidence rate per 100,000, I meant to fill that in, is 8.5, and Falmouth's percent positivity is 1.78, which is down from 2.25. So we've had, looking at the chart, you can see on the far right, we've had now 5 weeks of being consistently around 20 confirmed cases. If you add in the probables, which mean the rapid antigen tests, somewhere in the 20 to 30 range per week. It's been fairly stable now for 5 weeks. We recently had the road race and more people here. It seems that the case count has not increased as a result among Falmouth residents. So a fairly consistent pattern here over the last 5 weeks. I'd like to see it, obviously, we'd all like to see it lower, but it's not at a point. I could tell you with if we had no vaccine, had a low vaccination rate, those counts would definitely invariably be a lot higher with Delta, much higher. So I think it's a result of, people are starting to wear masks and maybe changing their behavior a little bit, and mostly to do with vaccination rates. And so even though breakthrough occurs, there's still a definite benefit to being vaccinated. So pretty consistent week to week over the last 5. This chart just indicates the steeper the line, the steeper that goes up, the steeper the curve, the more cases we're getting and the faster ramping up of cases. We're on an upward trend, but not, it's a relatively much slighter ramp up and increase in cases than we were seeing in that sort of winter to early spring of this year. And so again, consistently around 20 confirmed cases per week, which equates to about 2 to 3 a day. In the county, it's been relatively somewhat stable as well. You can see down on the far right, you're seeing in that sort of between 50 and 100, one day above 150, but other than that, consistently sort of, I see 66, 93, 77. So it's been sort of a little up and down, but not a giant spike like you saw in the green, which represents what we saw earlier in this year. So as far as hospitalizations, last week was 3, this week was 4, so it's been in that sort of 3, 4, 5 range. It was lower, obviously, in June into July. We had very few cases. We only had 3 cases for the entire month of June. So there's been an uptick, but not at a point where I would say that the hospitals are stressed like you hear in the news at some other states, like Louisiana, Florida, and so forth. So, hospitals we have none in the ICU as of this report on the 24th. In terms of the state's seeing well over 1,000 cases per day. There was 13 new deaths. I think it's been averaging between 5 and 8 to 10 or less a day. Our positivity hasn't really gone up much. The tests have increased. More people are getting tests. But our cases, I think last week when I did this presentation, was at 1,300. We're at 1,700 now. So it's been, there's definitely been, an increase in cases throughout. A lot of it's vaccine breakthrough and a lot of it's unvaccinated. So mostly unvaccinated and some vaccine breakthrough is the way I would describe it. Our trends, if you look up at the top, you can see that the positivity is flat. The deaths are somewhat flat. Cases are up. Shows a little bit down the last couple of days. I'm not sure why that does that, but it's showing for a 3-day average to be a little bit lower. Hospitalizations are starting to tick up. Again, at least locally, we're not seeing it to where the taxing sort of our system here on the Cape. In terms of 14-day average incident rate, this is all the towns in Barnstable County. You see Falmouth at 8.5. It's on sort of on the lower end from what the incidence rate in other towns are. Some towns are in the teens. Provincetown still, it takes a while to get down from what they had happen in July with the big outbreak that they had, but that is definitely like half of what it was last week. And so, that under CDC, an incidence rate under 10 is considered low. So that's daily cases per 100,000. So that equates to roughly between 2 and 3 cases per day, adjusted for our population. Percent positivity, like I said, we're down to 1.78. Even though we had about the same number of cases, it means we had more tests done. We're on the lower end for the rest of the county in terms of what our percent positivity is. In terms of vaccinations, pretty stable with vaccinations, at least countywide. We didn't go up any increase in percentage. As far as Falmouth goes, we had about 299 doses administered during the 7-day period, with 155 of them being first doses, 144 being second doses. So we're at 86% of all eligible residents have had at least one dose, and 79, we just clicked up that percent, of all eligible residents are fully vaccinated. That's a 1% increase over last week, with us seeing some gains pretty much spread out through the different age brackets. We're definitely well vaccinated compared to the rest of the country, and even higher than average for our county. So here you see the data. This is also I put on our website. So if you have trouble and you want to go back to this is on our website, as is the weekly case count chart that I showed earlier. So you can get this anytime you want by looking at the. I pull this right off from the state data that comes out Thursday nights, the state's municipality vaccination report. It's an Excel spreadsheet. And so I just pull that right off of there. It also gives you other data, different ways of looking at it. So if you feel like looking at it, you can get that as well. This comes from the state as well. It shows that there's been, since the cumulative count, total number of cases that have been vaccine breakthrough throughout the state is 15,739. Among them is 571, or about 3.6% or so. Hospitalizations among the 15,000. And deaths are 131. As a percentage of all fully vaccinated individuals, 0.35% of all vaccinated individuals have had breakthrough, so less than 1%. Hospitalizations have been 0.01% of all vaccinated people, and deaths among non-vaccinated people are 0.003%. So that's clear indication that vaccines work. It does also show that vaccine breakthrough does occur, but generally the symptoms are not at the hospitalization and death level, intubations and things like that. The vaccinations have clearly been effective, though you do see vaccine breakthrough. And this is also from the state's website. How to get a vaccine. If you've decided you want to get a vaccine, you go on the vaxfinder.mass.gov. I looked at it today just to make sure and see where we're at. Pharmacies are still there. Barnstable County Health Office in 6A in Barnstable does it once a week. Community MD does have some. Pharmacies are going to be a better bet. Community Health Center of Cape Cod has vaccinated. If you're homebound, you can't make it, you should call the Falmouth Health Department. So you'd call us, 508-495-7485, and we could work with the VNA to get some doses and do a homebound visit. Testing, Community MD has been, and CVS has done the bulk of our testing. Falmouth Hospital still does their testing. That's through the Falmouth Hospital. That's calling through your provider. The fairgrounds will be doing some so far right now, Sundays and Thursdays. And the Community Health Center of Cape Cod also does it. You can visit their website as well, call them. And so there's places you can get tested. In schools, we'll also be doing a test and stay procedure, so they'll be testing close contacts as cases may arise at the schools. So there's a whole program for that as well. If you want details, I'd suggest you reach out to the school department for details on it. So that's another thing that's going to happen for schools. Third doses. I don't call them boosters just because the boosters might indicate a different type of vaccine. It's the same vaccine. So third doses of vaccine for people that are moderately to severely immune compromised. There's also talk about after 8 months from your from your fully vaccinated, from your second dose or first dose, depending on what you got. We're going to start having clinics on the third dose. We don't have details now on it. You could use Mass Vax Finder for your third dose. I happen to click on the CVS one. It does give you an option to click on third dose. If you're in that moderately to severely immune compromised, this is right from the CDC's website if you want to go look at it. We're recommending it for those that are, again, moderately or severely immune compromised, and eventually the general population. How those clinics are going to look now is still to, I don't have a lot of detail from the state yet. Primarily, I don't think you're going to have the Gillettes and the mass vac sites. We may or may not. I don't foresee that. So it might be more at the local level, coming to the health departments, coming to, Barnstable County Health, Community Health Center. They were big at in vaccinating people. No reason to reinvent the wheel if we already have, ways that we've done it in the past. But the details aren't really out there yet. We're waiting for the state to see exactly how they want this rolled out. But you'll start seeing third doses of the vaccine. Pay attention to, we'll message it out. I'll have it in the weekly updates, also our website, as well as information comes to us. You may be probably going right through Mass Vax Finder again, just like we had. That site's still active. Like I said, I went on it today. Face coverings. Again, on May 25th, the Board of Health, in support of the Board of the Select Board, have a mask advisory. We advise in indoor public spaces. The state wants mask face coverings for the unvaccinated. Vaccinated with a weakened immune system should continue wearing them. Masks are still required for public transportation. So they haven't really had any discussions with municipalities on reimposing any guidance. So we don't have anything else from the states. This slide I haven't changed for a while, at least this portion of it. The CDC says all unvaccinated should wear masks in public indoor spaces. Vaccinated should also wear masks in areas of substantial or high transmission, limited stressed healthcare capacity, and low vaccination rates. So I'll talk about that in a second. And the state required this week for schools to start this year with face coverings. So that, I believe, came down a couple days ago. So that's something that will occur in the schools, and the schools will reach out to parents on that if they haven't already. So again, what would indicate whether we would want to go to an indoor face covering requirement? From the CDC, you look at these indicators again. So this is some of the data I gave you previously. Our incidence rate is considered low. It's 8.5, which is an increase of 0.3, and our positivity went down roughly 0.5% to 1.78. So we're still in the low category for our metrics or indicators of infection. Our hospitalization went up 1 in this count. So one there wouldn't necessarily change that sort of the hospitalization. And again, vaccinations are very strong. So those indicators, you take that in with the fact that our case counts have been pretty stable in that range. We haven't. The Board of Health hasn't considered, and the Board of Health, I've talked to the Board of Health about whether they find this to be an appropriate, tool to use, or whether going to a face covering mandate or not. So we're still at an advisory, and as long as the metrics show and this thing stays in this way, that's how we would stay. So that's where we are with that. As a recap, all the guidance went on 29th. Vaccine is eligibility for everyone in 12 or older. Third dose vaccines for those that are immune compromised. All right, our vaccination rates are very strong. Again, Delta variant, everybody knows, it's everything since July, just assume it's probably Delta. That's the vast majority of all cases. We're at a 5-week sort of case pattern of roughly 20 or so, give or take, confirmed cases, and between 5 and 10 probables is kind of been where we're at. Again, if we have a huge increase over the next days or weeks, then we can make adjustments with face coverings and so forth based on the metrics I showed you in the previous slide. So again, that's my update for the week, and I will do another one again next week. And take care, everybody. Thanks.